Hey everyone, before I begin the video, I have a favor to ask you. If you go to my website, www.smajourney51.com, you'll see that I've created a survey, and it's on the home page if you scan down just a little bit. You should see it, and you should be able to click on it to take this survey. It's only about 9 or 10 quick questions, and it'll give me an idea as to what you guys want to see on my YouTube videos and what changes that you may want to see on my website. So please take time out of your busy day and answer those questions so that I can get the information that I need to make your viewing experience even better. Thanks. Let's get started. Hey everybody, welcome to the SMA Journey 51 vlog. In this video, I'm going to be addressing a topic that many of us in the SMA community will probably have to address in our foreseeable futures. Not long after Scholar Rock's Phase 3 clinical trial, known as Sapphire, comes to an end, which will probably be within the first 2 quarters of 2023, those of us with SMA are going to see our treatments dramatically change. Most of us are used to going to our doctors every 4 months for our maintenance dose injections of Spinraza. And while some of you may be taking Evrysdi, the potential of Scholar Rock's apitegromab will revolutionize the way that we take our treatments. For those of us that are on Spinraza, we're already used to the normal blood test that they have to take before giving us our injections. Once apitegromab is approved by the FDA, we will now have to receive an IV infusion every 4 weeks, on top of our normal 4-month injections of Spinraza. Those of us with SMA typically have very small veins, and phlebotomists typically have a difficult time finding a vein. While they may be able to find a vein to get a blood sample, finding a vein large enough to put an IV in us can be a daunting task. The purpose of this video will be to talk about the pros and cons of PICC lines versus ports, and it's a subject that all of us should pay very close attention to. Let's first start by talking about what a PICC line and what a port is. What is a PICC line? A PICC line is inserted into a large vein in the arm by a doctor or a specially trained nurse. A PICC line doesn't require surgery to be inserted. After the PICC line is in place, a catheter will stick out of your skin on your arm. These are known as tails or lumens. Doctors and nurses can easily access this PICC line with a needle. Sometimes, PICC lines can be used to draw blood, which makes it easier for the patient if routine blood draws are necessary, and you can have more than one PICC line inserted if needed. What is a port? A port is a small drum made of plastic or metal with a rubber seal across the top. At the underside of the drum, a thin tube or line goes from the drum into the vein. Ports are inserted under the skin of your chest. This is also called subcutaneous. Ports have to be surgically implanted by a surgeon or a radiologist. Patients can only have one port. Typically, doctors are unable to use a port to draw blood. With a port, there is no catheter tails or lumens outside of the body. When it's time to use the port, the skin will be numbed with a paralytic cream, and a special needle used for ports will be inserted through the skin into the rubber seal. This is called accessing the port. Now, let's look at PICC lines versus ports. Both PICC lines and ports are used similarly, but there are some differences between them. PICC lines can only stay in for a limited amount of time, several weeks or months. Ports can stay in for much longer periods of time, several years. PICC lines will require special cleaning and flushing on a daily basis. Ports have less maintenance because they are under the skin, but they do require flushing every month to prevent the actual line from clotting. PICC lines should not get wet. During showering, you will need to cover it with a waterproof material, and you won't be able to go swimming. With ports, you can bathe and swim normally after the area has completely healed. While I understand that this is a lot of information to try to absorb at once, my goal in this video is to get you thinking about the topic of having a port surgically implanted. I am in no way telling you that this needs to be done, but I am recommending that you start talking to your doctors now and let them advise you as to the pros and cons for your particular needs. Having your blood drawn every 4 months may not be that big of a topic for many of us, but having to go through an IV infusion every 4 weeks will make it difficult for those of us with small veins. Once the port is surgically implanted, this will eliminate the phlebotomist or nurse from having to insert a catheter large enough for the IV infusion. In the last slide of my presentation, I'm showing you pictures of both a PICC line and a port. The picture on the left is an example of a PICC line. This is typically inserted in the upper arm, on or near the bicep, and you can see the 2 lumens or tails sticking out of the skin. One of these lumens can be used for IV purposes, and the other lumen can be used for blood draws. Again, PICC lines are meant for temporary purposes. The picture on the right is an example of a port. This port is placed around the chest area and is implanted subcutaneously under the skin. The line is then run or threaded through the vein until the end of the line is close to your heart. This is the procedure that I'm recommending that you speak to your doctors about, because if you're going to be getting an IV infusion of apitegromab every 4 weeks, this will help eliminate the cumbersome task of doctors or nurses trying to find a vein large enough to insert an IV line. Okay, so I hope you enjoyed the video, and I hope you got some information out of it that you can use as well. I apologize that this video was a little bit longer than most of my others, but it was important information that I thought you needed to know. I'm definitely going to be speaking to my doctors about having a port placed in my body, and I hope you do the same. Hey, if you enjoyed this week's episode, please give me a thumbs up and please subscribe to my YouTube channel as well. I would greatly appreciate it. Remember, when you do subscribe to my channel, be sure to click on the bell icon. That way you'll be notified of any new videos that I produce. I hope all of you have had a fantastic week. Do me a favor this upcoming week. Do something for yourself that's going to make you a better person. God bless you, and I'll talk to you in a couple of weeks. Bye-bye.